My doctor prescribed a new medicine, but it's just not helping. What should I do? That's what we'll discuss today. I'm Dr. Arthur Kolsky, founder and medical director of Advanced Acne Institute. We're a specialty dermatology practice focusing only on the treatment of acne. That's all we do. And we like to share our insights and our observations with others who are facing acne and wishing to navigate the path toward a clear skin complexion. So we hope you find this information useful, but this is not meant to be medical advice. So this is a common scenario. A patient comes in to see us and they say, well, I just saw a doctor and I was given this medicine and it's just not working. And I don't understand it. The doctor said it's a new medicine. It's got all these reasons why it should really be something that's going to help me get clear skin, but it's just not doing anything for me. So why is that? So we have this discussion routinely with lots of our patients because the main factor that I've discussed in the past is that when you go to the doctor and you're given a medicine, make sure you talk to the doctor about that medicine. Ask about the chances of that medicine working for you. Ask to see the effectiveness of that medicine in the actual studies. The doctor should be able to tell you, well, this medicine can, in most people, can make you better this percent of the time, or this much improvement. And those are important things to know before you decide to start committing to a particular medicine for the long term, because oftentimes it can take a few months before you really see good results with a given medicine. So on that level, it's important not to classify your treatment as a failure until you've actually given it enough time to work. So that's one important thing to know. So don't just use it for 2 weeks and think that you're going to have clear skin, because that's not going to happen. Usually it does take a few months to really get to the optimal level, and sometimes more than that. But on the other hand, sometimes medicines are never going to work, and we can know that just by looking at the data of those medications and knowing that there's a percentage improvement that those medicines are expected to deliver. But beyond that, typically in most people, they don't work more than that. So they may never give you completely clear skin. They might give you 30% improvement, 40%, 60%, but they may never give you 100%. Or if they do, it would be very unlikely that you would achieve 100% improvement. So it's important to have that discussion with your provider and say, listen, I'm committed to using what you prescribe, but I just want to know, what are the chances it's going to clear up my skin? Because that's really why I'm here. I want clear skin. I don't want just a little bit of improvement. And if that's the case, then you need to know. But there are some patients who just want a certain degree of improvement. They're going to be happy if they're 50% better, 40% better. And in those circumstances, that medicine might be perfect for them. So it's important not to just accept a prescription and move on when it comes to acne, because many of the prescriptions are not really destined to give you completely clear skin. And you want to have that discussion, and you want to at least know before you start using a product or a prescription, you want to at least know, what are the chances that this medicine is going to clear up my skin completely, or what are the chances that this medicine is going to lead to 50% improvement? You want to know those answers before you commit to a fairly long-term treatment, before you actually will know the outcome. And even with any medicine that we give you, there's no guarantee that any medicine is going to give you a particular result. So even if we use the strongest option, there's no guarantee that in you it's going to give you 100% clearance. But at least you would know the data. You would know that in most patients, in 80%, 90%, 20%, that we can expect to see complete clearing of the skin or not expect to see that. So it's important that you at least know what you're getting into before you commit to a fairly long-term treatment of a particular medicine that your doctor may have prescribed.